From KSMQ Television in Austin, this is On Cue, connecting interesting issues and interesting people. On Cue.
Telemedicine is not new, but typically it's been used in sparsely populated areas of our country. But today we're going to learn about a new application for telemedicine from Superintendent David Krenz of the Austin Public Schools and Melissa Barr from Mayo Health System. Welcome to the program.
Thank you.
Thank you.
Superintendent, tell us a little bit about how this idea generated of putting healthcare into the schools.
Well, as you know, in the community of Austin, Quality Pork started looking at on-site clinic for their facility and their employees. And it became evident that we needed to do something in the schools to broaden that base. So we began conversations internally on what we could do. And in that process, we're contacted by Mayo Health Systems that they were interested in doing something similar. And we began looking at it as a partnership at that point. We were excited about that. And mainly the goal is to provide quality health care at a convenient location and time for our employees.
When you work with companies or public entities that want to do something like this, is there a minimum size? You know, I think the school district is pretty big, certainly Quality Pork is large. Is that part of the requirement?
Not necessarily. We started actually the project internally with our own employees. We wanted to test some of our systems, policies, procedures internally before we broadened our audience and scope.
Mm-hmm.
But size doesn't have to be a limitation.
Okay. So in terms of the school district thinking about this, was it a function of employees don't have to go off-site to get health care? Are you looking at this as making the school day a little bit more efficient or just more convenient for your folks?
The cost of providing medical care for our employees was skyrocketing, as most employers have found. And we were looking at ways to control that, as well as the convenience, because we were losing many hours of productive time as employees had to take days off to take themselves or their families to visit the doctor. And we just felt, is there a better way to do that? We didn't know what that way would be, so that's why it was important to find someone who could bring that expertise to us and help dream on what could best fit the school.
Mm-hmm. Okay.
Yeah, this partnership between Mayo Clinic and the Austin Public Schools is really a win-win for us both. Mayo Clinic gets to really get our feet wet with the technology and the platform that we've got forward with using in seeing patients in this capacity. It's also a win-win for the Austin Public Schools. The quality is still that Mayo quality of care. Mm-hmm. The cost is affordable to the individuals. It's convenient being an on-site or near-site, and also that continuity of care piece with the information being retained and the integrity of the healthcare information being within the patient's medical record.
Right. I suppose a lot of the teachers are already using the system as it exists, and this just saves them the time of having to go to the clinic instead of right there in the building. Tell us a little bit about the kinds of things. Give us a picture of the structure. What's it going to look like when people walk up to the kiosk, is what you're calling them. What's it going to look like?
It is a enclosed station. It's blue and white, and it's about the size that fits a computer screen, a chair, and a bench for maybe 3 children or a couple more adults to sit behind you if you have dependents. The patient walks up to the touch screen, logs in via their symptoms. Maybe they have a sore throat, an earache, low-grade fever, maybe they have a rash. Based on the symptoms that are entered and checked, it goes through a series of asking, how severe the cough is, or how much
So almost like
drainage.
a little survey.
It's kind of a quick triage process, and that information is used then as discussion points with the provider once the consultation starts inside the station.
Okay.
So the patient gets checked in with the attendant. We have a Mayo Clinic Health System attendant that works right directly at the station during the hours it's open.
So you do have personnel on site?
Yep.
Okay.
They help with not only the registration process, but any insurance questions and insurance entering into the patient's medical record, and any help with any of the technology too for the patient along the way.
Okay. Superintendent Krenz, what's your goal in terms of, are you putting one of these kiosks in every building? Are you going to start at one building and see how it goes and spread out throughout the district after that? Where do you plan on putting
That's a
these?
good question. As we looked at the project itself, we learned a lot as we investigated other projects similar to this, not necessarily the kiosks, but on-site clinics. And one thing we learned is that it's convenience. Patients, employees would expect the convenience. If you can't provide the convenience, then they're just as apt to go to the clinic, go see their doctor in a more traditional fashion. So as we looked at it, we looked at our two largest sites, the high school and then the Alice I.J. Holton site. So we're going to actually place them not on the high school site. We're sharing a site with Mayo Systems just down the street from the high school. I think it's a block away. And then one inside of Alice. So that's the majority of our staff. So it'll be convenient for them. Now we're looking, if this is a very positive project, pilot, then maybe expanding it.
Great. So you mentioned a little bit about the types of things, or this survey, the questions that they go through. If someone is not feeling well, what kind of conditions would they come to a kiosk for? What's the breaking point of where, when, nope, this is pretty serious, you better head down to the physical site of the clinic or the hospital or the emergency room? What can you do at a kiosk?
Yeah, you know, in simplest terms, the symptoms and reason for visit at the station would be the same or similar symptoms that you would find while going to an urgent care, a quick clinic or a convenience clinic, express care clinic, that type of thing.
Okay.
We don't see patients who are having chest congestion or chest pains or severe abdominal cramping. Those types of things would not be appropriate. But your average, you know, sinus, allergy related, cold, rash, you know, fever, those types of things we could see at the station.
Okay. What do you do if it's something, in high school sometimes you see strep throat run through the population of students, but that requires one of those swabs. Can you do that at a kiosk, or do you do really more of a preliminary, and if you suspect that's where you're headed, you send them down to the clinic? Yeah,
that is a good question, and one that typically will come up. If the provider cannot treat by protocol, or there's no history of reason for treatment, then the provider could just enter in and put in those lab orders right directly through the lab, and the patient could just go directly to the lab for any tests that are needed.
Okay.
So they wouldn't have to be seen in addition to the station.
Make an additional stop.
Right.
Okay, great. Superintendent Krenz, is this going to be open primarily to staff members of the school district, or are students going to be able to take advantage of this?
In the beginning, we're looking at all staff members, those that are on our insurance and those that aren't. And we're working with Mayo Systems on how we're going to bill and treat those that aren't on the insurance. But to begin with, dependents of all staff will be able to utilize the systems. We're hoping that someday, as we expand, that it will also include student population.
All right, great. Give us a sense of timeline. These are underway. When do you expect them to be installed?
We do have one station set up at the second floor clinic at Mayo Health System in Austin, and again we're using that one to pilot internally on our employees. The site of the Ellis Middle School will be up in February, and the 408 Mayo Health System building will also be up in February.
Well, thank you so much for coming and sharing this news. We're looking forward to seeing how it turns out.
We are too.
Yeah, great, thank you.
More than half of all U.S. hospitals now use some form of telemedicine. Telemedicine is the use of telecommunication and information technologies in order to provide clinical health care at a distance. Consumers can even download health and wellness applications for use on their cell phones. It helps eliminate distance barriers and can improve access to medical services that would often not be consistently available in distant rural communities.
On Cue is a production of KSMQ Television in Austin, nonprofit public television.